and welcome everyone. My name is Jonathan Harms and I'm the CEO of Mental Health Carers New South Wales. Thank you for joining us today for this special webinar as part of Harmony Week. Before we begin, I would like to acknowledge the traditional custodians of the lands from which we are all joining today. I pay my respects to the elders past and present, in my case to the Gadigal people of the Eora Nation, and extend that respect to Aboriginal and Torres Strait Islander people who are participating today. We also recognise the lived experience of people who experience mental health challenges and the carers, families and friends that support their recovery journey, and recognise the valuable knowledge and insight of lived experience. Harmony Week is a time to celebrate Australia's rich cultural diversity and to reflect on the values that bring our communities together: respect, inclusion, and a sense of belonging for everyone. It also provides an opportunity to think about how we can better support people from all cultural backgrounds to access the services and support they need for their mental health. As Mental Health Carers New South Wales, we work alongside and advocate for carers, families, and supporters of people experiencing mental health challenges. We know that families play a critical role in the well-being and recovery of loved ones, particularly when it comes to young people. When a young person is experiencing mental health challenges, it is often the parents, siblings, extended family members and community networks who provide ongoing care, encouragement and advocacy. Today's webinar focuses on youth mental health in multicultural communities and the importance of meaningful and effective family engagement with mental health services. Young people from culturally and linguistically diverse communities bring many strengths, including strong cultural identity, close family relationships, and community connection. At the same time, some young people and their families face additional challenges when trying to access the mental health support that they need. These challenges can include stigma around mental health, language barriers, limited awareness of available services or systems that may not always feel culturally safe or easy to navigate. Families themselves may also feel unsure about how the mental health system works, what support is available, or how they can best advocate for their young person. For many families, trying to support a young person through mental health challenges while also navigating unfamiliar systems can feel overwhelming. At the same time, young people may struggle to find services that understand their cultural experiences, family dynamics, and community context. This is why conversations like today's are so important. When services work in partnership with families, recognise cultural perspectives, and engage respectfully with communities, support for young people can be much more effective. I'll now quickly run through a few housekeeping items for today's webinar. We are recording today's webinar to make it available for people who could not attend today and for promotional purposes. People's cameras have been switched off and everyone has been muted to facilitate the smooth running of the webinar. If you have a question during the presentations, please feel free to type it into the Q&A function at any time. We will monitor and publish representative questions as they come through. Questions will be reviewed before being published, so please be aware we may not get to all of them. We will try to pick a representative sample. We will hold all answers to questions until the Q&A session at the end of the webinar. During the Q&A session, we will do our best to respond to as many questions as we can. We will also review the questions after the session and follow up the most common and popular where we can. Today, we are joined by three presenters who bring valuable insight on youth mental health, multicultural communities, and family engagement. Associate Professor Abner Poon, MHCN's Policy Engagement Officer Armie Farooqui, and the Manager of the Transcultural Mental Health Centre, Cassaniti. Together, our presenters will highlight the importance of culturally responsive approaches to youth mental health and the vital role that families and carers play in supporting young people. Thank you again for taking time to be here today and for your commitment to supporting young people families and multicultural communities. I will now hand over to our first presenter, Associate Professor Abner Poon from the UNSW, who will speak about engaging transcultural mental health practice with young people and their families.
Thanks, Jonathan. Good afternoon, everyone. Thank you for joining this webinar. Let me share my screen. So today I'm going to present on enabling transcultural mental health practice with young people and their families. So it is a privilege for me to share this, especially in Harmony Week. So before I go into the research, I'm going to talk about the background of the study. So first of all of us will know Australia is highly multicultural. Around a quarter of young people in Australia were born overseas. In fact, if we add young people who are born in Australia or parents born overseas, we're talking about a huge percentage of young people in Australia that may be affected by mental health issues from multicultural societies. And we know that young people from multicultural communities often struggle to find support for their mental health issues. But at the same time, we know very little, we have very little evidence of what is good transcultural practice to work with young people and their families from multicultural and linguistically diverse communities in Australia. So therefore, we did this project together with Transcultural Mental Health Centre and with Mental Health Carers New South Wales. So there are three parts to this project. The first part is a scoping review. The second part is a qualitative method to identify the perception of mental health workers regarding transcultural mental health practice. The third part is to develop practice guidelines for mental health services for mental health workers. I'll present the two parts of this project. So in the first phase, we use a scoping review framework of ASCII O'Malley. We search for research evidence regarding studies conducted in Australia in the last 10 years. This is an important step to understand the extent of research being done, what has been done in the last 10 years. We wanted to find any form of facilitators and barriers of access and engagement with Australian mental health services experienced by young people from multicultural communities in Australia. So the scoping review of ASCII O'Malley consists of 5 steps to identify relevant papers. So the first step is to identify the research question. Second one, identify relevant studies. Third, study selection. Fourth, charting the data. The fifth step, collating, summarizing, and reporting the results. For this scoping review, we only included studies with empirical data that have collected data from young people, families, and service provider. So we mean that any kind of research that interview young people, or maybe they have interviewed family, carers, or they've done focus group, or done some kind of survey, we included those studies. This is because we want to capture the perception and the voices of this group of people in our scoping review. So in total, we found only 15 studies published in the last 10 years in Australia, which is quite alarming given that the importance of this research topic. And 13 of these 15 studies, they were peer-reviewed journal articles, and 2 of them are reports from agencies that conducted the studies. So we analyzed the 15 studies, and we categorized the findings into 3 main areas: perception of the young people, parents and mental health workers, barriers, and of course, facilitators in assessing and engaging with mental health services. Let's go on to them one at a time. So for perception, we found a reluctance in young people to seek mental health services. Some young people felt that involving their families was helpful, useful to support them in their mental health, but some young people had reservation to disclose their mental health to their families. And there are different cultural concepts and literacy that also affect young people from seeking help. For example, low levels of mental health literacy often create barriers for help seeking. And in some communities, there's a fear of authority and distrust of formal services, including mental health services. And this is especially for women and also for refugee communities. And the last part of this is the stigma of mental illness that stop people from seeking help. And shame has been reported in families when they do seek help for mental health problems. We also found some barriers, structural and service barriers. So there are financial, transportation, and language barriers. So for example, cost of services, cost of seeking help for psychologists, lack of proper transport, poor English speaking abilities, these are barriers. And most of you here, you will likely heard of these barriers being mentioned by your clients before. But the problem is when people do seek help, they find that services are not culturally responsive. For example, Western psychotherapy may not work well for youth with refugee experiences. Staff may lack cultural training and also services not sensitive to the needs of certain cultural groups. There are insufficient bicultural workers, and there are also reports of racism in mental health services. Also, many people find it hard to navigate services to find the help they need. There are fragmentation of services, and young people with complex health and social needs are often required to engage with multiple service providers, creating additional barriers for them. And how do we support young people? So according to the scoping review, we found that flexible service delivery is important, such as less rigid criteria and also flexible appointment. Secondly, provision of both practical and psychological support is important. Young people require both types of support. Providing only psychological support is helpful, but may not address all of their problems. In addition, adequate support from community and the families are important. For example, families having insight, providing emotional support, and also community having a strong network to support young people are so important as reported in the studies. So for the sake of time, I can only go through the findings briefly, but you can find more information from the two published papers that are available for you to download. So I will now go on to phase 2 of the project. So in phase 2, we wanted to understand transcultural mental health practice from the perspective of mental health workers. So using a qualitative method, we interviewed 13 mental health workers from Western Sydney Local Health District, which includes Transcultural Mental Health Centre. We selected Western Sydney Local Health District due to the high cultural diversity in Western Sydney. And mental health workers are recruited for this study. They were nurses, social workers, psychologists, and occupational therapists, which give us a wide coverage of the different professionals working in this field. So these are the 6 areas covered in our semi-structured interviews. So the demographics and work experience of the mental health workers, how workers engage with young people and families, what are the strategies to support young people and families, what kind of challenges do they encounter in practice, how do we improve mental health practice, and of course, the experiences of these transcultural mental health workers. So here are the main results. Firstly, there are factors that influence the mental health of young people. So parents' understanding of mental illness is important. So secondly, their struggles with life challenges could be they themselves looking for a job, they themselves affected financially, also their religious belief, also the expectation of the children regarding the future of their children. All these have influence on the mental health of young people. We also found varied but inconsistent transcultural mental health practice among the workers. So these are some of the useful transcultural mental health practice and strategies found by interviewing the workers. So number one, the starting point is practitioners' understanding of their own cultural backgrounds, along with the perception of their own cultural background towards other cultural groups. So that is the first starting point. Practitioners need to know their own cultural background and the implication of their background, how they see other cultures. So that is a starting point of good transcultural mental health practice. Second thing is staff should take time to listen, to understand their clients, not assuming that everyone from the same cultural backgrounds behave and respond in the same way. Sorry. And third, having a family-oriented perspective. So that means you need to consider families, who are the family members, the family dynamics, family expectation, the cultural backgrounds, and how to involve families in a family-oriented way. And of course, having a cultural lens to consider intergenerational factors, cultural factors that may affect young people. So young people need to balance their own cultural background. At the same time, they need to develop their own identity growing up in Australia. So there's a balance that young people need to do. So in order for good transcultural practice is to understand how young people need to navigate their own cultural background as well as their own identity. And these four practices, they actually came from experienced mental health workers from Western Sydney local health district. So based on what we found in phase 1 and phase 2, these are the four implications. First of all, we really need practice guidelines, how to support and engage young people and the families in mental health services. And these practice guidelines need to be made available to mental health services, not only in Western Sydney, but to different parts of New South Wales. We also need clear, culturally responsive practice that can address some of the challenges of mental health workers face when working with young people from diverse cultural backgrounds. And also this culturally responsive practice then become a routine practice as part of what mental health workers do. Next is to have some kind of family-oriented lens in mental health services that can support both young people and families. For good transcultural practice, we need to consider both young people and families together collectively, supporting both individuals and also the families. And based on all these things, we know that we need phase 3, which is to develop practice guidelines. So Marie will present phase 3 at the end of this webinar. And thank you, everyone. I'll pass this time back to Jonathan.
Thank you very much, Abner. It's great to see that we're building on the research that has already been done in this area, particularly at UNSW. But let me now introduce Armie Farooqui, the Policy Engagement Officer from MHCN, who will now present the results of a survey of mental health workers, many in the Family and Carer Mental Health program, on their experiences supporting young people and their families in mental health services.
Good afternoon, everyone, and thank you for joining us. Thank you, Jonathan, for the lovely introduction. My name is Armie Farooqui, and I'm the Policy Engagement Officer at Mental Health Carers New South Wales. Today, I'll be sharing some preliminary analysis from a survey exploring how mental health professionals engage with young people from culturally and linguistically diverse communities and with their families and carers. The survey findings are informing both MHCN's advocacy work and the development of a practical resource with UNSW and Transcultural Mental Health Centre to support culturally responsive and family-focused practice. So I'll briefly cover the introduction to the study, how we collected the data, key findings, and what this means for MHCN's advocacy and resource development. So we undertook this survey because while cultural responsiveness is widely discussed at a policy level, we wanted to understand what is actually happening on the ground So the findings from the survey serve two key purposes: to strengthen MHCN's advocacy for culturally responsive, family inclusive practice in mental health service provision, and to inform the development of a practical resource for the mental health workforce that can support their engagement with multicultural communities. This resource will also be informed by data gathered through a collaborative study with the University of New South Wales and Transcultural Mental Health Centre. So the survey was conducted between November and December 2025. We received 70 responses from across the multidisciplinary workforce that included clinicians, allied health professionals, peer workers, and those in youth and family focused roles. The survey explored experiences of engaging with multicultural communities, the barriers and challenges that are faced, training and resources available, and the level of confidence in practice. As you can see in figure 1 and figure 2, that majority of the responses that were received were from clinical professionals working in New South Wales Health and local health districts, followed by social workers, case managers, and family support roles at child, youth, and adolescent centers. In figure 3, it shows the most frequently engaged communities, which included the Chinese, Arabic and Middle Eastern, South Asian, and Southeast Asian communities. While some respondents included working with Aboriginal communities in this context as well, however, MHCN recognizes that Aboriginal communities have their distinct and unique lived experiences. In figure 4, training is limited and inconsistent, with most respondents reported relying on general workplace or mandatory training rather than specialized multicultural or trauma-informed learning. Figure 5 illustrates that confidence levels were often moderate rather than high, which could suggest gaps in support and preparedness. Several consistent barriers emerged. Firstly, stigma around mental illness remains a major challenge across many communities. There are systemic level barriers, particularly limited access to qualified and suitably placed interpreters, shortages of culturally relevant services and translated resources. And workers also highlighted complex family and cultural dynamics, including differing expectations between young people and their families around independence, life in Australia, cultural expectation, and help-seeking behaviors. Respondents reported using interpreter services, transcultural services, and translated psychoeducation material to facilitate their engagement. Specialist services and multicultural teams are frequently used for consultation, supervision, and referrals. A common theme was relying on personal experience or informal adaptations rather than structured evidence-based tools. So there is a strong need for resources that are practical and easy to use, youth-focused and locally relevant, and co-designed with communities and the mental health workers. These are the needs that were identified by the workforce, that there was a clear call for more support through training and available resources, particularly in family-focused practice, communication skills, and navigating complex service systems, and strengthening cultural responsiveness. Importantly, workers also noted that improving family inclusive practice overall could significantly enhance engagement with multicultural communities. From MHCN's advocacy perspective, one key message stands out, that resources must be practical and usable in real-world settings. Workers reported needing tools that support assessment, treatment planning, crisis response, and ongoing care, especially critical in high-pressure environments where time is limited, like inpatient units and emergency departments. Another key theme was the value of lived experience and peer roles. While widely recognized as essential, there is still a lack of these roles, particularly those reflecting multicultural communities. Incorporating cultural consultation and specialist multicultural expertise to support workforce capacity through collaboration is critical. These advocacy efforts will play a key role for us in developing resources to guide mental health workers. So for the development of the resource, family inclusive engagement emerged as a central theme. Workers highlighted the need for guidance in navigating intergenerational dynamics, cultural expectations, and the balance between a young person's autonomy and family involvement. Migration experiences and trauma also play a significant role in how families engage with services. So overall, this resource we will be developing in collaborating with Transcultural Mental Health Centre. This resource needs to be practical, clear, and easy to apply, grounded in real-world scenarios, and informed directly by communities. We have to move beyond generic multicultural support and provide community-informed, relevant guidance. These findings that I shared are still preliminary, and the next phase will include focus groups with young people, families, and carers to support this. So thank you for listening, and over to you, Jonathan.
Thanks, Armie. Very interesting. And although culturally specific tools will be useful, there's also definitely some common themes emerging from that research already. But for today's final presentation, we now have Maria Cassaniti, Manager of the Transcultural Mental Health Centre, who will share insights on culturally safe family engagement in mental health service provision.
Thank you, Jonathan. Happy Harmony Week, everyone. I'm joining in from the lands of the Darug people, and I want to acknowledge and pay my respect to the traditional custodians of the many lands from which we are meeting on today. This coming Saturday is the International Day for the Elimination of Racial Discrimination, also known as Harmony Day. It is a time to reflect, listen, and to renew our commitment to creating workplaces and services where everyone feels welcome, safe, and respected. And today, my colleagues and I chose to have this presentation because the project itself is a great example of work aimed at enhancing the provision of the best possible care with a focus on young people, families from COLD communities. Slide. So from the local research to date, and what Abner has shared, and our grounded day-to-day practice here at Transcultural Mental Health, we understand that culturally safe family engagement in mental health services involves fostering respectful, trust-based and collaborative relationships that acknowledge and embrace diverse cultural identities. And we see this on a day-to-day basis in the work that we do with our mental health services. There are important steps and practices which increase the likelihood of young people, families and carers accessing services which can lead to early intervention and better long-term mental health outcomes. And we see this often when our services engage with us. There are some important principles and strategies of cultural responsiveness through to cultural humility. What does that mean for some of you out there? Well, cultural responsiveness and cultural humility is a progression from cultural competence. Cultural humility is a continuous action-orientated practice which takes us beyond the skill set of cultural competencies to a mindset of curiosity and learning, where individuals acknowledge their biases and understand that people who enter their services are experts of their own lived experience. It encompasses ongoing learning, self-reflection, acknowledging and addresses empowering balances, and respectfully engages with our diverse cultural perspectives. And being responsive shifts the responsibility to professionals to be proactive in the building of respectful and trusting relationships rather than simply waiting for engagement. It also looks at organisational accountability, whereby organisations regularly evaluate their practices, ensuring services are accessible, responsive and inclusive. Now, culturally safe and trauma-informed care is distinct but interconnected to the concept of cultural responsiveness. Cultural safe and trauma-informed care integrates understanding of past trauma with respect of a person's cultural identity, their faith, ethnicity, sexual orientation and more, to create a secure and empowering environment. And at the same time, trust, rapport and safety is built by showing genuine respect, seeking input from community advisors, interpreters, and also our bicultural mental health professionals when required, and ensuring confidentiality is clearly understood. Transcultural mental health services recognise that culture, religion, spirituality, the impact of migration and settlement, along with adaptive cultural changes made by families and kin over time, and are an important piece of the puzzle for understanding a young person's story and their family's story as well. Exploring how the young person views their own culture and cultures that they move in, along with how they relate to culture of their family and kin, is necessary in supporting how mental health challenges are to be addressed. Along with this, family context is an important part of what our mental health teams consider day to day, acknowledging that for many, family is defined broadly and includes extended kinship networks, as well as having a deep appreciation that many cultures view health through a collective lens, making involvement of extended family essential. And last but not least, using an intersectional approach provides an additional lens to better understanding the ways different aspects of a person's identity, such as ethnicity, gender, socioeconomic status, sexuality, ability and age, expose them to overlapping and unique forms of discrimination and disadvantage. Slide. So if we go back to the three-phase project and the PowerPoint that Abner had up, we're now up to the phase 3 of the research. Therefore, our collaborative research is focused on building on what we have understood to date, and it seeks contemporary understandings from young people, families and carers about their experiences and perspectives on improving access to and engagement with mental health services. And so I underline the word contemporary because the small amount of research that's out there is now quite old. So this piece of work will really enlighten us in terms of what we do next. There has been very limited research undertaken, and so that we're hoping that this research and future research will break the dearth of research that's out there. The voices and experiences of young people, families and carers are fundamental to informing the work ahead of us. phase 3. Slide, please. So to recap, phase 1 and 2 of the research highlighted the needs for mental health services to use a culturally responsive lens to support the culturally safe engagement of young people and families into our mental health services, along with underscoring the need for family-orientated perspectives. Strategies to address structural and service barriers were also highlighted. Slide, please. The next slide. Thank you. So practice guidelines. So as part of phase 1 and 2, practice guidelines were recommended to improve access and engagement of young people and their families from culturally and linguistically diverse communities into our mental health services. So in phase 3, and this is the current bit of our study, we are conducting focus groups with young people and family members to capture their perspective. So we've looked at the literature, we have captured the perspectives of clinicians, and now we're turning our attention to young people and family members, which in turn will inform the development of practice guidelines. Slide. Thank you. So now we are inviting young people between 18 to 25 years old from an Arabic, Mandarin or Vietnamese speaking background who currently have stable mental health and at the same time may be experiencing a mental health issue or have experienced a mental health concern in the past. We're also inviting family and carers over 18 years old who have experienced caring for a young person with mental health concerns, and that also are from the same language groups that I've mentioned. So today we encourage service providers present, community members, people with a lived experience, families and carers to assist us with sharing the information about this much needed study. Slide. So if you wish to be part of this next phase of our work, please contact Abner, or for any other information about the study, please also contact Abner. And of course, for any other information, you can contact any of us here today. Slide, please. So our some of the research that we've referred to for today is up on the screen, as well as the research that we've conducted for phase 1 and 2. So thank you all again for joining us today, and I will pass you back to Jonathan.